Hey guys, Dr. Lera here. Update with Ginger. So Ginger is getting chemotherapy by an amazing veterinarian. I don't know if I'm allowed to say her name, but if you guys can see, you can see these needles all along her back. She's got some in her legs as well. And so these are all the areas that actually they're not all the areas for areas and the Ginger needs treatment. But one of the things that I'm learning is that when patients are getting acupuncture, sometimes they can get wiped out. And depending on how the patient's, I guess, level of health is and vitality, they're able to potentially tolerate more and they can handle more. And the doctor says that Ginger is a young 12 years old, regardless of her diagnosis of throat cancer. We're doing what we can, and I'm hopeful that this is something that will help Ginger. Doc is confident that it's going to help her as well. And so I just wanted to give you an update and let you know what it is we're doing and how she's doing. We did also make a change in her drugs. We stopped the Palladia just because it's a chemotherapy that can cause protein in the urine, and that can be problematic. Ginger's protein levels are actually getting kind of low, and that's something that's pretty normal for that drug. But now we have to pivot and we have to see what it is we can do to go ahead and make sure that we are providing quality of life. One of the things that was brought up to me was potentially doing radiation therapy. It's not something that would fix what she's got. It wouldn't get rid of what she's got. It would only help. At this point, it might shrink it down, or it would potentially go ahead and reduce a lot of the pain because of it works on the nerve pathways. We're not exactly sure how that works, but we know that's one of the things, or we think that's one of the ways that it would help with the pain significantly. My wife and I are talking about whether or not we're going to do that. There's a very fine line between doing things to the patient and doing things for the patient. And I'm constantly evaluating Ginger to make sure that she's her quality of life. And so I just wanted to give you an update on what's going on with her. As long as it's something that's not invasive, then we're happy to try it for her. If you guys found this video helpful, please subscribe, like, and share. If you guys have questions about this topic or any other topic, you can check out my clones.